Most often those babies have trouble with temperature regulation. The last 4 to 6 weeks are what are critical for baby putting on extra weight, their subcutaneous fat, which is what keeps them warm after they're born. If they don't have a thick enough layer of fat, then they can't keep themselves warm, they can't regulate their own body temperature, they can get cold, and then there's all sorts of complications that can arise from getting cold. And so that's one of the things that lands those babies in the NICU. The second is typically feeding immaturity. They're not ready to eat, they're not big enough to eat, and so they need to gain a certain amount of weight, and they need to be taught how to eat. And so that's the other common reason they end up in the NICU at that point. Jaundice will also put babies in the NICU for a little while. A lot of times those babies, their livers aren't mature enough to metabolize the bilirubin, which is what causes jaundice. And so they'll end up in the NICU for what we call bili lights, or special lights that help them eliminate that bilirubin from their blood. And then last, probably the least common, but the one we worry about the most, is respiratory problems. The babies who come out and they're not ready to breathe on their own, they need help. They either need a machine to help them breathe, which is usually just a mask over their face, and in rare circumstances, then the baby may need a tube in its throat to help it breathe as well.